What is the root cause of chronic pain? Is there even a root cause of chronic pain? Have you been misled by your doctors? Have you been tricked into taking treatments that you do not need under the guise of quote unquote solving the root cause of your issue? We will explore all of these things in today's episode. Hello, I'm Dr. Anthony Davis with Shapeshift Wellness, and this is the Health or Hoax podcast. Now, if you're watching this on YouTube, you'll see that the Health or Hoax podcast is now going to be hosted in video format on the Shapeshift Wellness YouTube channel. For podcasts, it will be under the banner of Health or Hoax. So you can find us in those different places. Several colleagues and I started this podcast originally when we were still in school, and then it kind of fell by the wayside. We tried to revitalize it together, and third time's a charm. This will be the third season, and I'm going to take the reins on this one myself and take it in a little bit of a different direction. I hope that you like where we're going with this. Now, with that housekeeping out of the way, let's get into the meat of this episode. What is the root cause of chronic pain? Is there a root cause of chronic pain? And of course, have you been misled by your doctors and tricked into paying lots of money for treatments that do not work under the guise of solving the root cause of your pain? First of all, I'd like to ask a couple of questions. I want you to reflect on these, and there's not really an answer to this. I'm not trying to bait you into thinking in a particular way. I want you to just think about this. When it comes to finding a root cause of your issues, why do you want to know the root cause? Why do you want a label for it? Do you think that by giving it a label, that will help in the treatment of this issue? Do you think by giving it a label that it will change the treatment for this issue? Do you think that it is a good thing to give it a label, especially if that label is a particularly scary sounding word like degenerative disc disease? Do you think that that helps to know those things? Or do you think that perhaps, and this is just a thought experiment, what if you did not know the diagnosis? And what if you made peace with the fact that you might never be able to identify a single root cause? And what if that was okay? What if instead of focusing on a label, a diagnosis code, instead you focus on function? You focus on what you want to do in your life that this pain or illness is preventing you from doing. And so instead of obsessing over how do I fix degenerative disc disease, you say, what is my pain limiting me from doing? Oh, it's limiting me from playing with my children and being the parent that I deserve to be and that my kids deserve to have. Well, then your rehab, your treatment takes on a different approach. Now, instead of focusing on changing the qualities of the degenerative disc, now we're focused on, well, what is it that you need to be able to do for your kids? You need to be able to squat down and pick them up. You need to be able to drive them to their practices. You need to be able to help them, move when they get older. Maybe they're moving into their first apartment. I don't know. You got to think about what it is for you that you need to actually be able to do physically and mentally and emotionally, and then guide your treatment around those specific things. And if you do that, then your treatment looks totally different than if you focus on a diagnosis. The next thing that I'd like you to think about is, do you think in the complexity of the human body, given how incredibly complex the human body is, and not just that, but the fact that this human body that you occupy is also occupying a very complex world with different types of food, people, places, things, cultures. You have your internal beliefs about the way that you and the world interact. And there's all of this complexity with the biological, psychological, and social constructs, environmental constructs, and factors. Do you think that in all of that complexity, that it is even possible to identify a singular root cause, whereby if you eliminated that singular root cause, it would completely eliminate your symptoms? Does that sound reasonable to you? Research shows us that especially when we look at chronic pain, I'm not necessarily talking about acute or sudden onset of pain, in which case there often is a singular root cause. It's an infection of a specific organ, or you fractured a specific bone. Fine. There you go, root cause. But when things get chronic, meaning they last for a long time, 6 months or more, then it starts to get a little fuzzy, right? It starts to seep into every aspect of our lives. And research shows us that there simply isn't a singular root cause at that point. Very rarely can our orthopedic testing, neurological testing, etc., muscle testing, you name it, identify a single structure in the body that is solely responsible for 100% of your pain. Now, we might be able to identify structures that are part of the puzzle. We might be able to say, oh, this joint or that muscle has some impact on your pain, and so we should try to resolve the health of that tissue. But research shows us very, very clearly that, much to even my surprise when I was learning this information, and I imagine much to your surprise as well if you're dealing with chronic pain, when we look at the relationship of pain to structural issues like degeneration or some type of asymmetry or muscle imbalance or postural issues, those things do not have a strong correlation with pain, meaning that most people are walking around with some type of postural issue or structural abnormality, and yet that issue is not currently causing pain for them. Therefore, you do not need to fix the structural issue as though you were a machine in order to alleviate the pain. You can heal from pain without fixing the structure. In many cases, not all, but in many cases. So let me paint an analogy for you to understand that concept a little bit better. We take a biopsychosocial model of healthcare, and what that means is that we have biological, psychological, and social variables that are all impacting your health. So we can imagine that your total ability to deal with stress, all the things that life throws at you, is represented by a cup. And if that cup overfills with water, you start to have symptoms or pain. Now, we have many things that can fill that cup with water too fast. That could be something like overtraining. So you do too much exercise, or you do an exercise that is too intense and you're not prepared for it. That's obvious. But the other things that can fill that cup are excessive mental or emotional stressors, right? So you got in a fight with your partner, or you're going through a divorce, or you're having a bad, time with your boss at work, or whatever the case may be. If something is stressing you out, that is filling your cup. The other things that can fill your cup in a bad way are, nutritional stressors. So if you're eating toxic, inflammatory types of foods, and those things are not going to help you to rest and recover and heal from the exercise and stressors that you're encountering throughout the day. So you have biological, psychological, and social or environmental stressors that are all filling this cup rapidly. And if it overflows, because you can only, empty the cup so much per day, meaning you can only rest and recover so much with each day. You can only get so much sleep to regenerate after you deal with these stressors. So if you're overflowing, there you go. You get symptoms, disease, illness of some kind. Something has to give. So there are two solutions. One is to stop filling your cup so rapidly with these things. Stop overtraining, do appropriate exercise, something that you're prepared for. Don't jump in too much too fast. Eliminate the sources of your stress. So resolve the fight with your significant other, or resolve the conflict with your job, or maybe quit your job. I don't know. But if you don't remove the source of the stress, the cup will keep filling up. And then stop eating shitty food. Stop drinking so much alcohol. Stop smoking anything. Stop eating super inflammatory foods. Those things are going to fill your cup too much. And that means that you have to rest and recover from those. So we can take stuff out of the cup, or we can make your cup bigger so it can handle more stuff. So we can build strength and resilience in the human body. We can do strength and conditioning. We can physically make you a stronger human being. We can also do that mental, emotionally. So we can develop more healthy coping mechanisms to deal with these stressors so that they do not affect us as long or as much. So take stuff out of the cup and build yourself a bigger cup. Now, the next thing that I'd like to talk about is how a diagnosis, or putting a label on it, might actually make things worse. So I understand why somebody would want to know the root cause of their pain. They want to put a label on it. They want to know what it is, because if we know what it is, there's this feeling that you can fix it. If you know that there's a hole in your boat and you're sinking, then you know, oh, I need to patch that hole. Now, unfortunately, due to the complexity of chronic pain that we just talked about, we can't simply fix a hole in a boat because, well, there are many holes, and the ocean is, tumultuous, and it's stormy, and you don't even know how to steer a boat anyway. And it's way more complex than just a hole in a boat, right? So knowing your diagnosis, although it's natural to want to know that, we know from research that if you know the name of your diagnosis and that name sounds scary, and especially if the information that's provided around that diagnosis is misinformation and it is nocibic, meaning it is meant to scare you, or that, it sounds scary, you will not get better. You will get worse as a result of knowing your diagnosis. So I want to repeat that. Knowing the name of your diagnosis, if it's scary sounding or nocibic, can make your pain worse and more disabling and make it much harder to recover from. So this is why with my own patients, I spend just as much time talking to them and re-educating them about the false beliefs that they have about their body, about how fragile they think their body is. And I am just sitting here telling you all about research that shows no. Like ACL tears, 2/3 of them can heal on their own. Disc herniations, also 2/3 of them can heal on their own. And guess what? The worse the disc injury is, if it's a sequestration or protrusion, it actually gets up to more like 98% of them heal completely on their own with no treatment, meaning your body is incredibly resilient. And even if you do have structural issues, they can heal. So unfortunately, with a diagnosis usually comes with it outdated information about how the body works. And this outdated information, by the way, this is being taught currently in schools, and not just, now I'm a chiropractor, but this is also being taught in physical therapy schools, in medical schools. Okay, so it's not just more of the alternative, oh, I'm a chiropractor, we learn bad information. Yeah, okay, we learned some stupid things for sure, but this misinformation, these false beliefs about how pain works and how pain heals and how resilient the human body is. I mean, imagine this is why medical students classically get that medical school syndrome. As soon as they read about every single disease, every common disease known to mankind, and they start to get the actual symptoms of those diseases just by reading about them, that's crazy, right? So these are just iatrogenic illnesses, meaning these are illnesses that are caused by the provider who's trying to tell you that you have the thing. And so we can make things worse as providers by miseducating you. So yes, even medical students, have a lot of fearful beliefs about how fragile the human body is. I just had a patient the other day who came in after a microdiscectomy, so he had spinal surgery, and his surgeon told him never to do a plank ever again in his life. That is insane. First of all, what was the point of getting the surgery in the first place then, if not to be able to do the things that this person loved? And by the way, they wanted to be very active, much more than doing planks. And second of all, if the surgical technique is so fragile that doing a simple plank can fuck up your surgery, you need a better surgery. And thirdly, it's just not true. We see plenty of research on these things that you can absolutely do a plank. And a plank is one of the simplest exercises that you can possibly do for core engagement. So 100%. It was safe in this individual's case. So he was just giving very, very bad information by an overly cautious and fearful surgeon who was just trying to cover his own ass, essentially. With no regard for the lasting impact on this patient, if this patient didn't have a good provider like myself to re-educate them and tell them they are strong and adaptable and they will recover. So this is another reason why we don't want to be focusing on the label of the diagnosis so much. It's nice to have sometimes, and it's nice for treatment purposes in some cases, but excessively worrying about the diagnosis is not a good thing. I have so many patients that come in and they just rattle off, I've got this disease and that disease, and I've been diagnosed with this and this and this and this, and I've got this in my spine and this in my shoulder and this. Can you imagine the brain space that all of these diagnoses are occupying for this person? It is becoming an intrinsic part of their identity. They are identifying with their illness, and not in a healthy way, not in a way that's saying, like, I'm making peace with it, this is part of who I am, that's okay. It's not like that. It's consuming who they are. It is driving decisions and disabling them. It is disabling them at young ages because they are obsessed with their diagnosis. So I would urge you to get scary sounding words out of your head. By the way, that case that I gave you, or that example of degenerative disc disease that I gave you earlier, that is a scary sounding word for a very normal sounding condition. It's not even a condition. It's just normal aging. It's normal age-related changes in the spine. It's the equivalent of getting wrinkles in your skin, but on your spine. It's just dehydration of the tissue. It does not matter for most people. Now, in severe cases, yes, it matters. But for most people with mild to moderate amounts of DDD, aka osteoarthritis, it is not a big deal, and you should just forget that you even have it. It does not matter. Now, another reason why we want to be aware of how the idea of a root cause is sometimes used against us. Now, this is tragic and unethical, and it really pisses me off because there are providers in my own profession especially, but also many other complementary and alternative medicines, such as acupuncture or massage or, Reiki or energy work or whatever. And there are many, many practices that will tell you they are going to identify the root cause of your illness and fix it and charge you lots of money for it. And, oh, by the way, you need to come in basically forever because it's a never-ending root cause. So these are the very unethical chiropractors who will tell you that your spine is misaligned, they need to put bones back into place, and in order for them to stay in place, you need to come forever. Forever. Cradle to grave. Forever. Okay? It never goes anywhere. They're not even focused on you and your goals, what you want to do with your life. It is 100% them focused on their own bullshit. They are sitting there sniffing their own farts. It's totally absurd. So those types of people will say that, oh, the root cause is that your spine is misaligned, or, oh, the root cause is that your chi is blocked, or your vital life force is blocked. Your energy is just, your chakras are, all out of whack, man. It's total bullshit. Do not believe any of it. All right. If anybody tries to tell you that you have chronic pain or a chronic illness, and that there is a singular root cause, and they explain it in a way that doesn't make any goddamn sense whatsoever, and they're not using words that actually exist. They're just using nebulous nonsense words. It sounds like, total word salad. Then just run far, far away. Trust me, you are better off with no treatment than treatment from people who are going to try to scare you about your own body, tell you that you're fragile, tell them that they are the magic person, they're the guru that's going to fix your pain, and only they can do it because they're the best. Yeah, run. Now, lastly, I want to wrap up by telling you about something called your allostatic load. Now, this concept, I think, is a really helpful and simple way. It's kind of like the cup analogy. Your allostatic load is essentially the total load of all of the stressors in your life at a given time. And so it's a way of basically saying, how much shit am I dealing with right now? And then you can use that to inform decisions about, well, how intense of an exercise should I be doing right now? Should I be taking on an additional project at work, or should I keep my plate clear? Can I take on more stuff, or do I need to rest and recover right now? Because sometimes your allostatic load is low and you've got all the energy and you can do all the things, and sometimes it's going to be high and you really need to rest. So let me explain what it is. Allostatic load, again, total amount of all the stressors that your body is under at a given time. So essentially, if we go back to that cup analogy, it's, well, today, right now, at this exact moment in time, how much stuff is in my cup. And it does not matter if that's biological stressors because you've been exercising really, really hard lately. It doesn't matter if it's psychological stressors because you're under a lot of stress with personal stuff or professional stuff. And it doesn't matter if it's social or environmental stressors because you've been eating shitty food or, not getting any social engagement or anything like that. So it does not matter what's in the cup. It just matters the total volume of all the stuff in the cup. And so if you've got a lot of stuff in your cup, now is not the time, today is not the day to try to beat your personal best record on your, your pace when you're running, or the amount of weight that you can lift, or, holding some crazy yoga pose that, you've never done before, or, taking on more responsibilities at work, taking that promotion, taking on another project. Though now's not the time to do that. It's time to rest. It's time to recover. It's time to get a nap, get good sleep, eat healthy food, take some time and just meditate, right? Now's the time for that. Now, on the other hand, so it's not all about, I need to avoid taking on stressors, because if you take on stress in the appropriate amounts, in an amount that you can handle, and then you follow that with appropriate rest and recovery, you will get stronger and more resilient. So if your cup has only a little bit of stuff in it and you've got a lot of room and you're feeling super energized and you're feeling just pumped and refreshed and full of life and vigor, then now is the time to take on the additional project at work, or to try to beat your personal records in some form of exercise, or to try something new and difficult. Now is the time to do that. Use that energy, but just don't do too much. Keep your eye on the cup as you add things to your plate. And if it starts to get full, then it's time to chill out, rest and recover, let your cup drain, and then you can start the process over again. And this is why in weightlifting, we used to use a percent of 1 rep max to estimate how much weight you should be lifting. So we would just figure out what's the heaviest weight that you could possibly lift one time. And then we'd say a percentage of that. Now I want you to lift 70% of your 1 rep max for 3 sets of 10. And the problem with that is that means on a good day or a bad day, on a day where you got shitty sleep and you ate a bunch of tacos, versus a day where you slept like a baby and ate a bunch of anti-inflammatory like Mediterranean food, well, doesn't matter, right? Then the same day you have to do the same workout. Whether you feel like shit or you feel good, you have to do the same workout, which is stupid because then you're putting yourself at a higher risk of injury during that workout. So now that's why in weightlifting, we're switching a lot to a rating of perceived exertion or reps in reserve, which is just a concept of saying, oh, well, scale of 1 to 10, how hard do you feel like the exercise is today? And then you pick up a weight that's heavy enough for you to feel like it's, a 7 out of 10 difficulty, and realize that today versus tomorrow, your 7 out of 10 is going to change because of your allostatic load, because of how much stuff you have in your cup, right? And so then it gives you permission on days where you feel super energized to push it, to really push it. And then on days where you're feeling drained and overwhelmed, to take it easy. So all of this is to say that you have permission to listen to your body. So please leave it in the comments. What do you think about the root cause of pain? Do you think it's helpful to know the root cause? Do you think that it's helpful to put a label on it? Do you think that there even is a singular root cause for chronic pain? Or do you think that it's maybe causes, plural? Please do comment. And not only comment on that, please do let me know what you think about the root causes of pain, but also this is a new format for both my Shapeshift Wellness YouTube channel as well as the Health or Hoax podcast. Please comment and tell me what you think of this, because I have a lot of podcasts planned and written out already. And I think they're going to be very, very helpful and engaging. But I want to know ahead of time, are you enjoying this form of content? And if not, how can I make it better for you? I'm Dr. Anthony Davis. Remember that movement is medicine, food is medicine, sleep, music, nature are medicine, people are medicine. So take control of your health. And I'll see you next time in the next episode of Health or Hoax.